But isn't diabetes supposed to mean high blood sugar levels? What's it got to do with low blood sugar? I don't know, sometimes I feel really dizzy, or I start sweating like crazy, or my hands start shaking like this. All of a sudden, my heart starts beating really rapidly. All of these are symptoms of hypoglycemia. What is hypoglycemia, you may ask? Now, generally, there's this big misconception that diabetes, especially type 1 diabetes, has got to do with a lot of high blood sugar levels. But in reality, most type 1 diabetics experience a lot of low blood sugar levels as well. And the main reason being that you are taking external insulin. Your body is not producing any insulin, or very minimal insulin itself. Hence, a lot of times there is an imbalance between the dosage of insulin you took and the amount of carbohydrates you ate in a meal, which means your sugars will drop below 70, which is when you will start experiencing the symptoms of hypoglycemia, where you feel really dizzy, and in very serious conditions where hypoglycemia is not treated, yes, you could faint or go into a coma, worst case scenario. But the main causes of low blood sugar, one is overdose of insulin. Now, sometimes you might think that you're gonna eat a lot, but then you don't end up eating as much, which causes your blood sugar levels to drop. Especially since you might have put a higher dose of insulin and then not actually eaten enough for it. Another major cause of hypoglycemia is heavy exercise. Obviously, working out is amazing for diabetics or anyone in general. But at the same time, it's really important to eat something at least half an hour before you work out. Or if you're going to be working out for long periods of times, which is over 1 or an hour and a half, you definitely need to have at least 15 grams of carbohydrates in between to make sure that you don't experience any hypos during your workout. So this is especially important for athletes or people who do strenuous workouts for long periods of hours. Another major cause is traveling. So the changes in your schedule might cause your blood sugar levels to drop because you may not be eating on time, or you may not be having your meals as properly as you're supposed to, or there's a lack of carbohydrates in your meals, or you accidentally over-bolused, or some kind of mistake has, taken place. And a very small mistake that a lot of people, forget about, that actually happened to me recently, is a malfunction with your insulin pen or your pump. So recently, my cartridge for my long-acting insulin, which is Tresiba, which is generally a really effective insulin, actually better than Lantus for avoiding hypos in night, which I used to experience a lot. There was a bit of a problem with the cartridge itself, and when I pushed the units, some of it kind of leaked out, or there was some issue with the pen, and I didn't realize that for 2 days. So that impacted a lot of high blood sugar levels, and then I would put a lot of insulin, causing low blood sugars, and it was a lot of ups and downs in my sugar levels because of the malfunction of the insulin pen itself. So it's really important that before you inject yourself or use your pump, especially when you inject yourself, you should check with at least loading 1 unit of insulin and checking if it's actually working normally. Because if it is not, it could be dangerous. Now, the most important thing is, how do you actually treat hypo? The main and easiest way is just drink around 110 ml of juice. So make sure that you have Tetra Pak juices with you at all times, especially when you're working out or going to the gym or going camping or going outdoors for a very long period of time. It's great to carry something like a little juice box with you, just in case you experience any hypos. You don't have to go searching for food all of a sudden, because you might be in a place where you may not get food instantly, or you might not be in a position to actually walk that far to the shop and actually buy something. And in case no one's around you, you don't want to cause that kind of hassle. So just for convenience, like, always carry something like brown sugar or a Tetra Pak juice box, or something like dates, just in case of hypos. Another way to treat it, especially when you're about to eat a meal, is that eat your meal halfway and then put insulin. So let's say if your sugar was something like 65, you could eat half of your meal and then put insulin. So that way you're not going to end up increasing your sugars a lot by drinking a lot of juice and eating. And at the same time, you're treating your hypo as well. Basically, at night, make sure that whatever juice or whatever treat you have, like a chocolate, is always next to you. So it's very easy to grab in the middle of the night, because there are chances of fainting at night, and night hypoglycemias are the most dangerous, actually. So if you actually live with someone like your partner or your parent, it's really important that they are actually aware of this, because your loved ones will genuinely be one of your biggest saviors. And in case, worst case scenario, if you do end up fainting, it is important that at least the most loving people in your lives that you actually interact with on a daily basis know how to use a Hypokit. So that is actually an injection which has straight glucose in it, which they can load and inject onto you in case you have fainted and you're not able to actually consume anything like honey or juice. This will help boost your sugar right away. And it's really important that this treatment is given as soon as possible after you faint, to avoid going into a coma. Now, I know these things might sound really scary and you might have a fear of, oh my God, what's gonna happen to me and this and that, but you're gonna realize that it's actually not as bad as it sounds. Although initially you may feel a bit uneasy and a bit shaky, your hands are shivering, you're having mood swings, you're confused, you're lost. All of those emotions are very normal when your blood sugar levels drop. So it's important that you're transparent about it with everybody. And I'm really, really curious to know your tips on what you do when your blood sugar levels drop, or what your relative does when their blood sugar levels drop, and if you've ever seen them treat a hypo. Let me know in the comments. And that's it for this video. See you in the next one. Bye bye.